Hello. So what's your
Hello.
name?
Yes, I'm Maiyshla. I'm from Mauritius, and here in Mauritius, I have been involved in community health more towards mental health and well-being for young people. And we have done several initiatives to involve the community to raise awareness about mental health and also break the stigma because it is still very present here.
My second question is, how is community health organized in your country?
I would say it comes from grassroots level of initiatives that really people who identify problems, issues that are happening, and then come up with solutions. But at the same time, there needs to be collaboration and communication. So it is quite an issue to come up with good community health projects in terms of the organization itself. We see that initiatives come from different, it can be from non-governmental organizations, private industry, or educational institutions. It can be in several different ways, but there is no real concerted effort as such to say community health. So sometimes it can get lost. It is community health, but it can be termed as social work or volunteer work. Concerted effort is a bit lost, but initiatives are happening when we see that it is community health in practice. But sometimes even the people doing it are not aware that it is community health. Yes.
Okay, thank you. My next question is, what have you learned in the past few years about community health and building resilience?
So what I have learned, I think mainly being involved in community health, it has really been that that aspect of keeping the authenticity. So coming up with authentic, not trying to coming into a community, not trying to control the community or impose solutions, even though if in terms of if I have a background in health, I would know some things that maybe that specific population do not know in terms of, let's say for me, young people, the focus on mental health. I have information, but it's not for me to come in and just distribute the information in any way that won't work. So I see that coming in authentically, proposing things, offering that listening space, that safe space for people to share what are issues, that opens up for things to happen, for us to come up with solutions. But I see that listening aspect and also keeping authentic connections. So when I'm real, I see other people also can be real themselves and can share their real problems, not try to cover things, so that then is you can move on to genuine solutions and real change. So from this, I've seen that more and more. I see that coming in the way that even though I don't know everything, sharing that I just know this bit, I have this health promotion background, but you on the other side have the connections with your community, and together we can make it work. And I find that there's so much learning that happens in terms of I learn from the community, and I get inspired from them, and they also at the same time get the knowledge and the skills. I find this is the authenticity is the greatest learning from this.
Yeah, thank you very much. My fourth question is, what role can community health workers play to improve resilience in communities in times of crisis?
I think, yeah, they are crucial because they get to work directly with the community, and so they, in time of crisis, that's when the information has to be shared, and there has to be people in touch with the community, and the community health workers are well placed because they already are in touch and they are already doing the work. But in terms of building resilience, then it needs to be, we need to ensure that community health workers are well trained for the times of crisis, that what can happen. And I think it comes back to emotional well-being as well, to ensure that how to manage when emotional crises happen, because during these times it's important to manage emotions, and health workers, they need to have these skills to be able to ensure that they know how to because during times of crisis, that's when emotions build up. And if I think if community health workers are well trained in how to deal with that, that would be a plus. And then in times of crisis, we can work together already to add on to, let's say, for example, for COVID-19, in terms of, let's say, distribution of masks or information sharing, it's specific in different communities. They would know what's missing, what is certain information is not being shared, maybe needs to be translated in a specific language. So that closeness is there. But in terms of crisis, we still need to ensure that the capacity building is there, so that they are well trained. And yeah, I think their role is crucial, but maybe sometimes it's overlooked, that they don't have enough credit.
Yeah. Okay. And then finally, what advice can you give from where you are now to the new generation of community health workers?
I think it's to be open to learning and growing, mostly, because I find that keeping that curious mindset and just working together, and also that human connection, I think that is what makes really the change happening. So I would say the advice is to keep that curiosity curious mind, and keep asking questions and trying to solve issues, because it's when we come together really that we see that most sustainable change can happen. And yeah, I think that's for me as well, and for others.
Okay. Thank you very much.
Thanks.